I'm Angela Sweeney. I'm a senior lecturer at King's College London in user-led research, and I'm director of the Service User Research Enterprise here. And we're a group of people with lived experience of the kinds of things that we research, ranging from autism to trauma survivors and so on.
Hello, I'm Jane Chevous and I'm part of Survivors' Voices.
I'm Laura Fischer. I'm the founder and CEO of Traumascapes, which is a survival-led organisation dedicated to comprehensively addressing trauma through art and science. Our project was called T.R.A.U.M.A, which was an acronym for Towards the Recognition of Abuse, Understanding and Mutuality Through Arts. And our aim was to create an arts-based card deck to support abuse recognition and facilitate conversations around the topic of abuse. The card deck essentially is gathering artworks created by a survivor arts collective that we put together, as well as reflective prompts and instructions on how to use the card deck safely and sensitively.
We came together through a project called Safe Scenes Supported, and one of our dear colleagues had come up with a project that she felt was urgently needed, which was to reach out to children and young people who were in lockdown in their homes during the pandemic and who may have been in abusive situations. So we came together to do a piece of research around that and to create messages of hope for those young people. And through doing that research, we found that there was a real need to increase the understanding of abuse, what it looks like for yourself when you're going through something like that yourself, but also how to recognise the signs of it in other people. So that's what brought us together, and we share, I think as often happens when survivors come together, we share values, we share an ethos and a way of working that means that we come together in what feels like very supportive, understanding ways, and it kind of gels you in a way and creates quite a strong group, it feels like.
Our research, Safe Scenes Supported, which found that one of the top priorities for survivors was to build public understanding of abuse and support abuse recognition, because a lot of survivors don't know that they're experiencing abuse, and also for the wider community to know how to recognize abuse in others in order to support that. So we wanted to build on our research. You have your deck of cards which showcase 48 artworks plus prompts, and as I said, instructions on how you might use them, so that you can take that in your own space with your friends and family or in a therapeutic context and have those conversations and be supported by the artwork that articulates some of these complexities.
And it's probably worth adding that coincidentally the IICSA inquiry made its report last October, when we'd already planned the project and started the project. And one of their key recommendations was that there was a need for a public awareness campaign to help people to recognise and talk about child sexual abuse. So we preempted IICSA really, and this is our mini contribution to a public awareness campaign.
So it's definitely about relationships. In survivor research, when survivors come together, the kind of relational often takes precedent and is where the work flows from. So those relational approaches really are key. I think a challenge is that we're managing this kind of work on top of everything else often that we're doing, and carving out space to make sure that we're able to come together in the ways that we want to can be really challenging.
Relational space is both a strength and a challenge because it takes extra work, and it's not the work that is valued by the funders in terms of the outputs. It's the work that enables the outputs to happen, but it takes extra time from what you're able to often to justify in a budget or a funding bid. And while our partnership with BAM has been incredibly supportive of our approach, it is sometimes a challenge to fit everything in and to pay the full attention that we wish to building a mutually supportive team. So definitely I would have liked us to have had even more time to work with the other members of the Arts Collective during and after. And sometimes it's felt like we've had to rush to get some of the finishing things done. The methodology was also innovative in bringing together researchers and artists. And as someone who doesn't identify as an artist, as a writer and a researcher, but not an artist, it was quite challenging. It was quite daunting working with other people who were like amazing artists and trying to produce something that could be visually represented on a card.
I just add to that on the arts perspective. I think the strength of survivors coming together and learning together was that we got to explore these really tricky, nuanced issues, because we had to navigate the line between exploring abuse in order to enable recognition and discussion, but not depict abuse, nor support specifically prompt disclosure, or to look at more creative expressions of trauma which have a different purpose. So really specifically looking at creating artworks that enable abuse recognition and discussions versus all these other aspects of it. That was a very tricky but fascinating aspect of the work, and to really tread that line also between enabling the topic to be understood and explored, but not make it too distressing, so we were not depicting abuse, but we were still enabling that recognition. So that subtle line in between, and also covering themes but enabling interpretation and having a space for people to make their own. So really kind of all these complexities was a challenge to tackle with the collective, but a really exciting challenge and an amazing learning opportunity. And I think it really highlighted the power of art to express all these complex experiences, which words are far too limited to do, especially when considering that trauma is an embodied non-verbal experience. So it was a real strength to be able to use art in that way and meet a clear need and create a tool that is needed, because we don't have a lot of ways to support these conversations. And we know from the initial feedback we've had that it's been really helpful for people.
Relationship and safety are two of the key kind of fundamental principles around co-production in this field, in the area of violence, abuse and mental health. And we based all our work on the principles of the Survivor Charter, which kind of tries to articulate how you can work on that basis, that in a way that is the opposite of the experience of abuse that people with lived experience have been through. So that's in starting by ensuring safety, paying attention to relationships, and ensuring that we're accountable to each other in the work that we do, and that we look after each other's well-being. So that was a really important part of what we did. We spent time when we met as a collective at the beginning and end of each session, just on self-care, and we supported each other all the time that we were working on the project, because at times it can be triggering to work on this if you're being lived experience yourself. So you need to allow for that and allow some flexibility and to sort of mutual care within that. And then the other thing that one of the other principles in the charter is that it shouldn't be like serious and distressing the whole time. We should ensure that there's some nice moments, there's some fun, there's some celebration, there's some joy from the basic things, like we always made sure we had great food and lovely homemade snacks, and to kind of celebrating what we'd done together, and just having a bit of time over lunch to hang out together, so that it it wasn't all really serious, heavy stuff. I don't know what I've missed off, but I think
One other principle, I think, is not taking a paternalistic attitude to whether or not people are able to take part. So what we tried to do was have quite in-depth conversations with people to a certain extent about what it might be like to take part, and to allow people to choose for themselves. And I think that's a really important principle, because it's not for us to say whether or not somebody can take part, but we also have a duty to make sure that we're not creating very harrowing spaces, like you say, without people being fully aware of what they're getting into. So walking that line, I think, was really important, and never at any point veering into sort of paternalistic attitude where we take decisions on behalf of other people.
Yeah, duty of care, but respect for agency.
Exactly. Yeah.
Lived experience involvement is massively important. Nothing about us without us. And the voices of lived experience change not just what we research, but how we research and the outcomes of research. So absolutely essential that we do it. But again, to do it well, it has to, and it would be immoral and unethical to do it badly. And to do it well, there has to be more funding than is generally allowed for.
One of the reasons that people go over and above to deliver is because they're trying to deliver to a target that maybe wasn't reasonable in the first place if you're working in a relational way. So I think if you're doing fairly traditional smash and grab research, it can be quite a nice, quick, in you go, get your data, write your paper. It's not like that when we come together and do research. It's never going to be like that. And it's always going to need more time and more space, I think, which just often isn't possible with the deadlines that we can find ourselves working to.
This work just deserves to be given more time and resource. And we went above what we had, but we still would have liked to do more. We would have liked to get together with the Arts Collective more often, get together between us more often, and we did as much as we could, but it did feel limiting at some times where we couldn't do that for various reasons, and just having more time and space, I think would have just circumvented a lot of the challenges that we felt. I don't know if you agree with that.
Yeah, completely.
And I think that's also about having, again, BAM have been a very supportive and very flexible, but also having, there is always these really hard deadlines with funding for getting the reports finished and things like that. And for various reasons, we didn't start at the time that we'd anticipated starting, and so we've had to really kind of crunch the final things into too short a time. And so it'd been nice to have longer, to spend longer evaluating and start to do some impact evaluation. We are getting feedback from people about how they're using the card deck, which is great. But we haven't had opportunity within, officially it's all finished now, and we haven't had the opportunity to do a formal impact evaluation because there hasn't been time for that to happen. It needs a bit longer. We will do something. We will follow up, and we'll also seek more funding to follow that up because I think it's so important. But I think having that sort of a bit more flexibility.
Yeah.
I think one of the strengths in the way that we approached this as a co-produced project was that we paid a huge amount of attention to how we recruited for the Arts Collective. So there's two things. There's one is that all three of our organisations, SURE, Traumascapes and Survivors' Voices, spend a lot of time and attention building up communities of practice. So we already had relationships with survivors and other survivor groups from which we could, and artists, from which we could start to look at recruiting people for the project. So we knew that we had access to a wide range of people from the survivor community and the art community from different strengths, different experiences, different practices, and then we ensured that we had a lot of information available about the project and ways that people could express interest and have discussions before actually going through a formal recruitment process. And then when we first came together again, we spent a lot of time building that relationship as a collective before we even tried to do the actual work of the project. So that attention to having existing relationships in the communities that you want to work with, rather than just thinking you could put an advert out and people who know nothing of your work, and have no other support are just going to jump and get involved and it will all be okay. That actually you're ensuring that you're working with people who have support around them already, or at least some people. Obviously you want to bring new people on board, but and I think the other thing of that is that we also pay attention in the way we build these communities of practice that we all have, that we're bringing survivors and people from different backgrounds, so we're paying attention to intersectionality. So it's not just the same people working on the same projects all the time.
Yeah, I mean, when we work on abuse and trauma, there's a number of things to put in place as we've kind of outlined already. But one of the key things is to reduce unexpectedness as much as possible, because that's one of the characteristics of abuse, and to give people as much information as possible so that they really know what to expect and what they're getting into and can make informed decisions about it. So before we meet, we create an information pack which contains all the information on how what to expect, on the context of the project, on reiterating the purpose, the plans, the what we're looking to do, but also what to expect on the practical level, where we're meeting, what kind of things we'll be doing, and things about lunch, as well as it's for all levels of information, so that they're really practical to the more in-depth concepts, and we do that in a fully designed pack, so it feels accessible to digest in terms of engaging in that information instead of being one big long block of text, but it also shows how important it is. So I think adding, making things really visual and really well designed also shows that there is attention and care, and that what we're doing is valuable, and it isn't just something we get on with. It's something we really care about, and their expertise is important and valued, and we demonstrate that in many ways. But one of these ways is that attention to the design and to the ways that we communicate, as well as what we communicate.
So the key findings that we felt were pretty critical from our research, and we consulted the Arts Collective as well, so we kind of came up with them together. So we felt that there's a really clear need to do this kind of research, and to create this kind of card deck, that there aren't many tools that can help facilitate conversations around abuse. So there was a real need to do that, being demonstrated in the work that we did earlier, but also I think the response to what we've done as well. We also think that what we've demonstrated, we think, is that these arts-based card decks or arts-based work can be really meaningful ways of generating conversations. There's loads of considerations around that, like making sure that we're not depicting things that are harrowing and incredibly distressing, and that there's sensitive portrayals of aspects of trauma or abuse recognition that open up conversations. So it's not any art, we think, and there was a huge amount of thought that went into the kinds of art that we use to depict the themes. And I guess the third thing that we talked about was the power to communicate beyond the verbal. So we all know as survivors how hard it can be to find the words that explain the things that have happened, or the way that we're feeling and the impacts that has had. And art can do that in ways that we can't through words alone. And again, I think there's been some really good feedback around the power of art to do that too.
We didn't want to be prescriptive about where these cards should be used. So we recommend that people use them with others. And that can look very different from one situation to another. So it could be in the therapeutic context. We know some therapists who have given us feedback that they've used them with their clients. And it's worked really well, and then their clients have gone on to get the card deck for themselves. And then we've also heard from people who are using it with friends or with family, and so it's really broad. In fact, yesterday I was giving a lecture on one of the masters that I teach on, and I used the card deck within the class as well, in a different way, of course, because it has to be adapted to sensitively to a teaching environment. But it was really, really powerful as well. So
I think more important than who the cards are for is how the cards are used. So like Laura said, it's not about kind of targeting specific groups, but so the cards are there for kind of anybody to use in that group situation. More important to us was specifying how to use the cards in a safe way, how to engage with them safely. So we've included a booklet with the card deck, that gives some kind of general principles, some things people might want to think about, ways of kind of grounding maybe after using them. And we also say, if you find that the cards aren't right to use, that's fine. And if you find that they're never right to use, that's okay too. This isn't something that is for somebody in that we're targeting. It's there as a tool for people to use if and when they feel able to, and to do so in the safest way.
Having said that, it's striking me that one of the other ways I'd love to get some funding and some resources to follow up on the project is to offer training courses for different groups of practitioners in how to use the cards. And some of the practitioners I think would be most key to do that with are those in education. So because these are adult cards like FE and HE rather than schools working with the under 16s, but I think education is a really key gateway to people being able to disclose or identify abuse, particularly familial abuse, is happening. I think with mental health professionals, because we know that many people with trauma from abusive experiences end up trying to access mental health support, but are not often enough asked appropriately about the experiences that brought them there. And the cards would be a really helpful way that those conversations could happen better than they do at the moment. And then I'm thinking the frontline services that pick up people whose trauma means that they're finding it difficult to navigate society. So like housing and homeless services and probation and drug and addiction services, I think is where a lot of people who are struggling with the impact of abuse end up. And having a card like there that again enable people to identify the journey that brought them there, and therefore the help, more appropriate help that they need. I think those would be key services where I would love to see the cards used.
First, we want to really explore how these cards are used and perhaps evaluate that more formally and explore the different settings and different usages and how people are finding it. That we have started collecting really, really good feedback, so that's encouraging. But we also would like to have further funding to develop a deck specifically for children and young people, because currently it's for adult survivors of childhood abuse or people using it within a population that is adults, so whether they're survivors or non-survivors. But we haven't made them specifically for children and young people, so that would be a really important extension of the work.
And I think it would also be good to explore other ways of bringing art into these conversations. So not just card deck, but that other both events and other resources that could be created. So a series of videos, for example, or Instagram posts or TikTok posts. Particularly we're looking at young people, other means of using art to promote the conversations, and expanding. We did quite a lot of work on safety guidelines, and some of that we were able to reproduce in a booklet that goes with the card deck. But it's essential that we don't just provide people with cards, but we provide them with a lot of support and guidance about how to engage with the cards safely. And particularly, for example, that we're not expecting members of the public to be able to diagnose that people have been abused or they're experiencing trauma. And these are ways to have conversations. They're not diagnostic tools. But I think that there's probably a need for even more resources and guidance for both practitioners and just members of the public in how to have these conversations well and safely, and how to then respond. I think another follow-up piece of research would be good, would be to look at how to support people to respond once they are aware that perhaps somebody has been abused. One of the things in the earlier research we did, the Safety and Supported project, we did have a part of that was some discrete work that was done with a group of young people. And one of the things they identified is that they would most likely tell a peer rather than an adult, if they were experiencing abuse. And the young people saying, but we need help then to know what to do if one of our friends tells us that they're in an abusive situation. So I think that's another piece of follow-on research that I'd love us to get funding to do.
Yeah.
I think there's also something about capturing the values that underpin these survivor spaces that I think would be really nice to do, to kind of capture the ethos that sort of permeates all of this work and communicate that to other people, I think.
And actually both members of BAM and of some of the other research teams we know of that are working in this area, so like the Mesart team at Coventry, we're already having conversations about putting together a survivor researcher toolkit and survivor research toolkit, so both for survivor researchers and researchers who are not survivors but are co-producing in this area, so some practical guidance and tools of the kind of things we've been talking about that other research teams can use. So it's exciting to see that that's already being taken forward.
We had these amazing interdisciplinary team that we worked with for survivor artists who work across different mediums. We have Lou Hale, who's predominantly a spoken word artist, but also worked through visuals and collage in this project. We have Julian Triandafilu, who is predominantly a filmmaker, but also worked through collage and really complex, subtle word plays, which you can see in the deck. We have Abby Lake, who works with textile and clay and also explores word plays. And we have Sullivan Holderback, who's a multidisciplinary artist and worked through drawing, sculpture, pretty much everything actually in this project. And he was also a core part of putting the card deck together and designing the whole thing. So all four of them have just been the most brilliant people to work with, and it's really, really key that they be recognised.